Atrial scarring following an atrial-based repair of transposition of great arteries is an important concern which has led to the introduction and acceptance of arterial switch as the better choice. The likelihood of maintenance of sinus rhythm decreases progressively as years pass by after a mustard operation, being 72% at 1 year, 56% at 5 years, and just 43% at 13 years. The reason could be damage to the sinus node area during surgery, as well as damage to the internodal conduction pathways and scars acting as nidus for reentry circuits. Recurrent atrial flutter may need ablation, though it may require a retrograde arterial approach because the focus may be in the pulmonary venous canal.